Hi there, everybody. My name is Michael Lay, and today I am celebrating Star Wars Day, or May the 4th. So, May the 4th be with you guys. And I'd like to start my video presentation off with this image. And this is a Star Wars image, obviously. This is Jedi Master Ki-Adi-Mundi, and he is characterized by his large cranium. And of course, what's inside the cranium? The brain. So the brain is part of our central nervous system, and there are various medical subspecialties that deal with it, but primarily neurologists deal with issues of the nervous system. So neurologists have several different subspecialties, and I worked with many of them. So neurologists can specialize in sleep disorders. You've got sleep doctors, but neurologists can also specialize in movement disorders as well. And of course, there are general neurologists who, of course, work in close conjunction with geriatric specialists. And now, geriatric specialists, not to be confused with neurologists, deal with aging people, but neurologists can also deal with not just aging people, but even younger folks who might have movement disorders. And now, of course, neurology is not to be confused with neurosurgery. Neurosurgery involves, of course, surgery, where neurosurgeons would make incisions either somewhere along, somewhere close to your brain or along your spinal cord. And once again, neurosurgeons are also not to be confused with orthopedic surgeons. So orthopedic surgeons may also deal with spinal cord injuries, but they are more primarily concerned with issues of the skeletal muscle system. So that covers medical specialties. Now I'm going to talk about the primary organ of the nervous system itself, the brain. So the brain, anatomically speaking, is the most superior central organ in the human body. Of course, um, it is where everything is processed, and it controls everything from sensory information to motor movement of our bodies. It is just so integral. Now, the brain, if I were to talk about it a little bit more, uh, is lies inside deep to the cranium. So now you've got, and it can be further split into different lobes. So you've got your frontal lobe right here, which is very important for executive control and function or decision making. And then there is a sulci right here called the coronal sulcus rather, that separates, or central sulcus, pardon me, that separates the frontal lobe from the parietal lobe. So the parietal lobe extends from the frontal lobe and now more centrally from ventral to dorsal. It integrates with the occipital lobe in the back, which lies inferior to a lot of other aspects of your brain. And now lateral and central to each of these lobes. So I've talked about the frontal, the parietal, and the occipital. There is the most lateral and central temporal lobe. And yeah, so the parietal lobe deals with sensory motor functioning. The occipital lobe deals with sight, occipital vision, and the temporal lobe sort of deals with other senses, but also comprises the midbrain. Now, the midbrain lies deep to the rest of the brain lobes and central, deep, and below, so inferior. So the midbrain actually integrates with the brain stem, and the brain stem proceeds downward into your spinal cord. So speaking of midbrain, one of the very important organs or parts, rather, of the midbrain is the hypothalamus. And the hypothalamus, as I've talked about in a previous video, helps regulate homeostasis. It also is very important for sleep. So my research actually dealt with issues of neurodegenerative diseases and sleep. And one of the parts of the hypothalamus I'd like to talk about is the ventrolateral preoptic nucleus, which is one of the anterior nuclei of the brain, of the hypothalamus. And the hypothalamus secretes, or the VLPO rather, secretes a hormone called orexin that contributes to one's wakefulness. So the more orexin you have, the more awake you are. And for people with dysregulated or dysfunctioning brains or neurodegenerative disorders, they might have high levels of orexin affecting their sleep. I worked with people with progressive supranuclear palsy, which is a movement disorder. It's a rapidly progressively neurodegenerative disease. So people with this disease, it's a very rare one, and and when it is diagnosed, people often die within a couple of years. So people are unable to move. People with this disease can be characterized by falling backwards. Their ocular motor function might suffer as well. They experience drooping eyelids. Eventually, because of the cranial nerves that stimulate the throat, even or the muscles nearby the throat, they will not be able to swallow, which of course is fatal. So, people with this disease have a high level of that hormone that I mentioned earlier, orexin. And so, something that my group worked with was we developed a clinical trial comparing Ambien, which is a sleep medication, with Belsomra. And Belsomra's a mechanism of action actually inhibits orexin. And so, in theory, it would help people with PSP sleep a little bit better. And yeah, so that's a little bit about what I did when I worked with neurologists and clinical studies. But but yeah, so today I've covered Star Wars, I've covered different medical specialties involving the central nervous system, and I've also covered anatomical regions of the brain. Alrighty, everybody. I hope you guys have a wonderful early summer day, and I'll see you guys soon. Thank you. Bye bye.